Smoking Cessation Introduction. The addictive ingredient in smoke is tar. Select true or false. Correct. The addictive ingredient in cigarette smoke is nicotine. Kim is 16, and her dad has smoked as long as she can remember. Kim has never smoked, and she doesn't plan to start. Since she is a non-smoker, she is not at risk of getting cancer, breathing problems, or other smoking-related illnesses. Select true or false. Correct. Anyone nearby when a person is smoking breathes in the exhaled smoke. Kim has breathed in her father's smoke all her life. She has also been exposed to all the toxic chemicals left by the smoke in her house. She is at a higher risk of developing smoke-related illnesses than someone in a smoke-free environment. Smoking can cause bad breath and inflammation of the gum. Select true or false. Correct. Smoking makes it more difficult for saliva to remove germs from your mouth. This can lead to gum disease, which can lead to bad breath and even tooth loss. It is better to set your quit date a few months away so you can prepare. Select true or false. Correct. Your quit date should be within 1 month. Which one of the following is not a good way to increase your chances of quitting smoking? Choose one of the following options. 1. Throw away all your cigarettes and ashtrays. 2. Smoke a small puff from a cigarette to help you get through a rough spot. 3. Stay active and busy. 4. Avoid people or places that may trigger your urge to smoke. Correct. One of the first rules of smoking cessation is to not smoke. Even a small puff can harm your chances of quitting. If you are in a rough spot, try taking a short walk until the urge or stressor has passed.
Thank you for using Explain.